Can we call the meeting for, at 7:08?
Yes. Indeed.
Okay. And if there, can we accept the minutes of the
So
last meeting?
hold on.
Hold on.
So
Just-
I'm reading the minutes. And I thought we approved the minutes and it said that I motioned to table the minutes. Unless we did that later on in the meeting, I went back to the
No, I
recording.
thought we did approve it.
We did. So
Okay.
that's the error.
Okay, that's the error there. Okay.
So it should be to accept the meeting.
Okay.
I was like, wait a minute, I don't remember that. And that may be why, because I was just checking the town website and Jennifer's been incredibly up to date and loading accepted minutes into the Board of Health page.
Well, that's because Cindy sends them to Jen.
Right.
Mhm.
Right, but if it was written that we
So
tabled,
if Cindy wrote it that they weren't accepted, she wouldn't have
Right.
sent them.
my-
Okay, so who wants to make a motion to accept it with the change?
I'll make a motion to accept it with that change.
I'll second
Second,
that motion.
Right,
all in favor, Laurel?
aye.
Linehan, aye.
Cindy? Aye. Silver, aye. Anybody object? Okay, so move to accept those meetings, those minutes.
Elaine, we do have one person from the public who was on.
Okay, let me see if I see them. I don't,
Yes,
Yes.
yes, DS, uh-huh.
I don't know if she wants,
Do
she,
you, do you want, whoever it is on DS, would you like to identify yourself?
She already identified herself, Elaine.
Yeah.
So Debbie, is there anything else that you wanted to say or were you?
No,
just listening?
No, I just wanted to listen for a little while and I probably won't even be able to stay for the whole meeting.
That's fine.
well, welcome.
Okay.
Riveting news.
Nice to have you.
Thank you.
Okay, so if we go to the approval, health director's report, Ruth, you're on.
So I kept trying to write it and everything kept changing. So I decided I would just do it tonight so that you had the latest information. So I sent you the latest updated spreadsheet. It did not include today's number because I didn't have it at the time, but I got it an hour ago. So today's number is 935. You can add that to the list. We did have 32 new cases on Monday. 26 of those were from the testing on Sunday.
26.
So we tested 725 people. There were, Cataldo says there were 32 positives. We show 26 positives, but the other 6 could be other residents of somebody besides Wakefield or Melrose. So 32 out of 725, which is a good, healthy 4% positivity rate. There were 5 people under the age of 19, a high schooler, a middle schooler, an elementary schooler, and the other 2 elementary school students do not go to the Wakefield Public Schools. 2 of them were symptomatic. The other was a member of a household who had a positive. So the 3 that were positive were there because they were suspecting that they were positive. We did 20 school department people and 10 town employees and 1 light department. So it did go very smoothly. Cataldo really has this down pat. They did a fabulous job. They have a blow heater that goes, they have a trailer that they set up with that blow heater, so they were nice and toasty. And they're really gonna need it this weekend.
I know,
Um,
regretting I signed up.
So
The new coat.
there, that part went really, really well. Our part went well. We had 3 police officers, 2 down at the bottom at Farm and Hemlock, and 1 at the guard shack, which was, where our people were, and very close to the testing because the trailer was, I don't know how to explain it, but all the way around and back around. So it was just before you would go out. So we had the maximum amount of queue.
Yep.
And the line only went like a little bit down the hill at one point of the day. The rest of the time, it was much more manageable. Most people had less than an hour, but some had maybe an hour, hour and a half wait. But it really did go very smoothly. We had 2 admin people at the guard shack. They checked everybody's ID, asked if they worked for the town, the school, or the light department, and passed out information sheet that the people had to fill out. And everybody filled it out, even those who pre-registered, which was almost everybody. They just use that as a double check. They don't have to re-input all the information, but they can just look at it and make sure that everything is correct. So, and then on the back of that sheet, they give it back to them after the test. And on the back of the sheet is all the information about how to get your test results. So phone numbers, emails, the name of the email that it's coming from. So it's a far cry from the first testing thing I did in July in Melrose. So so it was very good.
Did you find, Ruth, was there a lot of families or did you find more adults?
More adults.
Oh, okay.
Yeah. So I haven't checked with Cataldo to see what the signups are to date, but I'll check with them on Friday and see where we're at, just so we have a rough idea as to what to expect.
So Ruth, where do you want people who are helping to access the site? Do you kind of just go, I'm trying to figure out, should I
So
like
what's your shift?
2 to 5? So I'm thinking a park at the football field and walk in.
Yeah, as you come up Hemlock, first of all, you don't have to wait in line. So just go around the line.
Yeah. And
then there's gonna be a sign that says no parking beyond this point. And it's right where those side parking lots are.
Right, that's what I was thinking. Yep.
Yeah, so you can park there and then it's just a little bit of a walk the rest of the way.
That's exactly what
there is the electronic sign saying that, road closed, but we had people that literally didn't see the sign. I'm not sure how, but
want to go
they
to break.
didn't.
Yeah.
We still had a lot of walk-ups and bikes, which personally, I would, if it was up to me, I would say nobody has access, because it just makes me very nervous to have all these people walking when there are people sitting in cars. But it seemed to go fine. The walkers stayed way off to the side to get to Breakheart. So we thought, all right, we'll let it, but they have to park down where I just talked about, or at the bottom of the hill. We had purchased with our public health emergency preparedness funds last year. We had purchased an inflatable light fixture. Kind of looks like one of those blow up snowmen that people put on their front lawns, but it's in the shape of like a big flashlight. It's like the same height as the guard shack, and you plug it in. And we had Melrose, Wakefield, Malden, and Medford's, because we had each bought one. So we had all 4 of them there, and they did a great job with the lighting, because Public Works only has 1 portable light tower.
Oh, good.
Which is fine, but it's only 1, and that's just not enough. So,
And you get into darkness.
well, yeah, it gets
Yeah.
dark early.
Mhm.
So
Oh, let's check the weather forecast.
Yeah.
you don't want to look yet. So, if you remember when we did the functional exercise at the vote
Mhm.
several years ago,
Yeah, I remember
in our
that.
after action report, we didn't really have too many things we were suggesting on improvements, but one of them was portable light towers.
Yeah.
So we used our money to buy those, and
Good
they're
thing.
about $1,100 each, but
Mm.
they are a bargain. Great. And I'm gonna see if we can use some of this year's money to buy another one or two, because we're gonna use them for the COVID vaccinations,
Mhm.
especially if we actually can do them in outside in the spring. It's still gonna get dark early, so they're a great investment. And if we can't use our FEP money, we have a healthy revolving fund, and maybe we just want to buy another one or two, at least one other one.
I mean, it's so, when I think about excellent lighting in town, all that excellent lighting is on a sports field.
Yeah. Mhm.
You certainly can't drive across a sports field, but we might want to think about timing and location and available lighting if that doesn't, if we need it. So, I think the middle school parking lot, which is the most modern building, probably has the best lighting.
But we can't do it in the middle of town. We
Right,
just don't have the space,
right.
but we have enough lighting to do it there.
Yeah, no, and it's great to be able to use the Vogue.
Yeah, you'll see this weekend. It really great. I don't know, we haven't gotten any complaints. So we're going to be doing it again Saturday and Sunday, and we'll see how it goes. And I'll report afterwards to the board, just as an email, just so you
Mhm.
know
Yep.
what's going on. So other COVID news,
Mhm.
late breaking news is today on my call with DPH, we were the first group to be told that if we have the interest and capacity, we can immunize our first responders
Mm.
who have been asking,
Mhm.
what about us? And my answer has been, we've been told that we will not be doing immunizations until the spring phase 3. That's my story, and I'm sticking to it
Mhm.
until 11 o'clock today, and boom, breaking news. So I'm meeting with Tom, Steve, and the fire chiefs tomorrow afternoon to just talk about it and have them do a survey to see how many of their people want it and talk about some of the logistics. But
Okay.
if all goes according to plan, we would be immunizing fire and police as early as, well, no earlier than the first week in January. We're looking at the first and/or second week of January. We're also doing it as a coalition, because to do it, we have to have a minimum of 200 people getting vaccinated, which obviously we can't do. So between Melrose, Malden, Medford, Wakefield, Winchester, and Stoneham, there are a little over 800 first responders.
Hmm.
So and if you take maybe a 70%, we'll take it. I don't have my calculator here, but whatever 70% of 800 is probably how many will end up immunizing. And we have a million questions, because literally this was just sprung on us today. But is it a check? Oh, 560. Thank you. But that's among the 6 communities. the plan at this point is we would do them in our own communities, but there'll be a central distribution. However, we're gonna try to set it up so that we do them. You talking to yourself, Elaine, or are you?
Yeah, I'm trying to write and talk to myself at the same time.
That's
Repeat
okay.
it. My brain's going.
Go right ahead.
Yeah.
We're gonna try to stagger them so that a Wakefield police or firefighter could go to Melrose, could go to Stoneham, Everett, you know, they could go to any of the other ones if they live closer to there or their schedule, it works out better for the schedule, whatever. So there'll be a lot of flexibility as to where they can go. There will be some cost to the town. It's being run like the flu clinics where we bill Commonwealth and get reimbursed. But we're only going to be reimbursed $40.50 per person for both shots.
Ooh,
God.
What's the cost?
Mhm.
Well, we have no cost for the vaccine. However, there's some ancillary small costs, like we need to buy sharps containers. I believe it comes with the alcohol wipes. It won't come with Band-Aids.
Syringes, no syringes either, right?
No, it is. It is coming with syringes.
oh, good, okay.
Yeah. So there's a list, which of course I didn't print out, but it's vaccines, syringes, alcohol wipes. I feel like there's something else, but it doesn't, I can't remember. But then of course, we may end up paying people to administer the vaccines too. I'm not sure we can depend on volunteers to do all this. The
Are they
vaccine,
going to allow at these particular ones, like where you're having them in the certain towns, will they put in anything from DPH or the state that your EMTs or your paramedics will be able to administer?
well, EMTs are not. Paramedics are. But that doesn't mean they're gonna wanna be giving,
Mhm.
a lot of paramedics are not really comfortable with giving shots, and they may not wanna be giving it to the guys and girls that they work with. I was gonna say something else. Oh, vaccinators will get vaccinated too.
Okay.
So vaccinators will vaccinate each other. And
I
and
help.
then-
Yeah,
Yep, and then vaccinate the others. So,
good.
I mean, this is literally hot off the press. And so whatever questions you have,
Mhm.
I probably don't have an answer to, but ask anyway, because, you know,
Well,
it's maybe questions
no,
we
it
haven't
would-
thought about.
This is more logistic and medical. So they're saying that, the good news is there seems to be some reaction that really talks about the fact that you are getting an immune response to it, which is good. You want that. But I just want to, be mindful that we stagger first responders so that they're not all calling sick,
Yeah.
the
No,
day
that-
after the second
We've already
vaccine.
thought of that.
Okay,
The hospital is doing the same thing, so that, the hospital started
May, June,
immunizing this week.
Okay, yeah.
And, they're being very mindful about how they're setting up the schedule so that, they don't lose a whole unit. So we'll be doing the same thing.
Okay.
It's gonna be logistically a challenge, but I think depends on how badly they want it as to and how the unions respond. There'll be plenty of availability to be able to be immunized, not anywhere near their shift,
Mhm.
Because
Yeah.
they're going to have 6 different communities they can go to.
Yeah, no, that's brilliant.
So that's the advantage of being part of the coalition.
Ruth, how do we plan on following up with people to make sure that we're able to give them the second of the 2 series? Like, is someone going to be reaching out to them or? Okay.
Yeah. So what we'll do is I don't know if this new software system will be live by then, but there's a new software system called PredMod that they had tried to have up and running for the flu season, which I knew that would never happen. They're thinking it's going to be ready for at least when we're doing the public clinics. I don't know about January for just these small clinics. So it's a software system that will have the ability to do reminders, and it will also simultaneously put the information into the MIIS system, because we still have to do that. But these are small enough numbers. I mean, we're talking, if we had 70%, we have that would be about 70 people between fire and police.
I mean,
And
it seems to me that leadership in fire and police should be able to manage that. Like, hey, you're on the docket and you're due. It's, kind of like nurses having to have their CPR by a certain day.
yeah, what we'll do is we'll have a sheet of paper to remind them that they can take with them.
Mhm.
And then we can also, I think that's a really good idea, instead of us having to do this.
Yeah, I mean, come on.
We give it to the two chiefs and say, your staff
Work
should
away.
be calling these people on these days
Yep.
to remind them that, that they need to go within that range. And these are the dates and places of the next round.
Good.
So that's pretty exciting.
Is there a range past 21? Is it 21 to 28, 21 to forever?
We haven't gotten the vaccine information sheets or anything out of the inserts, so we haven't, again, they're telling us it's gonna be the Moderna vaccine, not the Pfizer.
Oh, good.
So, but they haven't, we don't have, I don't even think the state has the package inserts that have all the particulars in it.
Well, just got approved.
But I do know it's a pretty extensive, like with flu, we just say, are you allergic to eggs? Have you ever had the shot before? Have you ever had Guillain-Barré? There you go. This is much more extensive. So I think, hopefully we can give that to the people in advance. They can fill it out in advance, and then we could just briefly go over it before they get their shot. So much for saying we're not involved until the spring.
Yeah.
Spring is very early this year.
Yeah, but it's a good thing to be a little early. It really is. It is.
Yeah.
It is.
Yeah,
It is.
and if there's limited people that want it now, potentially after we do it, maybe a month later, people will be a little bit more receptive to it, after they see that the people they work with are fine and whatever.
I think that's it. I've heard comments from a few other health departments and a lot of first responders that one of them said to me, if you don't take it this first time around, and you then all of a sudden in 2 months, when everyone else has got their second one, and then all of a sudden you see that everything's okay, where are you going to be? Are you going to be put at the end of the line, or will you be able to say, I changed my mind?
You'll be able to say you changed your mind.
Yeah.
But, we'll be given enough vaccine based on the number of people we say we need. But of our 6 communities, 2 police departments had already asked their people, and one had 65% saying yes, and the other one had 70% saying yes.
That's
And
good.
that was not Wakefield. We haven't asked
Yeah.
that.
That's good. That's
I
very
think that's probably about right. I will tell you, for Melrose Wakefield Hospital, it's 100%.
Wow. Awesome.
Who want it?
100%.
Yeah.
That is awesome. Good.
I've talked to staff, and this second wave is just, they're just so disheartened.
Everywhere.
They're just,
You just feel helpless
Nope,
and
too
like
much.
they just have As my daughter said to me, you think that this time around, you'll be a little better, but the same effects emotionally
Yeah.
and physically. And it's just like, here we go again.
Yeah.
What did we do? What did we work for?
Yeah.
Sad, very
Yeah.
sad.
So I'm pleased that they're starting. Thank goodness.
Uh-huh.
What else do I have about COVID? Nothing. Our numbers are not good. However, doing these community, doing this volume of tests should lower our positivity.
Oh,
So-
dilute it, yeah.
It will dilute the positivity, so our positivity should go below 5%.
Mhm.
And so we'll probably go off red just because we'll have diluted the positivity.
Are we still contact? I mean, Maine has given up on contact tracing. They
I
just
don't
give
blame
up.
them.
And I'm like, well, what are we doing then? But so we're holding our own, or
Well,
Mhm.
so,
I don't know
question.
how do you answer that one?
no, I can answer. Well,
Yeah, go ahead.
Elaine can talk about it firsthand.
Oh.
I did do the training for Maven. I
good.
did the test. I'm waiting to get access. Once I have access, I can give you more specific numbers because I learned in my training
Yeah.
that there is a report that I can run, and actually, Elaine, you could run it, that will tell you how many cases were sent each day to the CTC. So if we know how many cases we got and how many sent were the CTC, I can give you more information that's concrete as to how many are going to, how many we're doing and how many the CTC is doing. We have hired a woman for 30 hours a week.
oh, good.
Oh,
For
great.
100% Wakefield.
Oh, awesome.
So, so she's going to be, well, she's signed up. She hasn't heard back about getting into the class for Maven on Monday. However, we can still give her cases to do, just not in Maven, to get her going. Last week, I looked at the payroll a little more closely, and we had done 20 hours of contact tracing on top of Karen. And that's nothing compared to Melrose, which did 85. The difference is all the school nurses in Melrose are doing the full case contact tracing for everybody in their school. The Wakefield school nurses will check to see if they have any contacts within the school. And that's great,
But they're not.
but that's as far as it goes.
Yeah.
So there's a whole lot more, as Elaine knows, to do.
Yeah.
So, so there's been a big difference between how many cases we really get to in Wakefield. At this point, it's pretty much just been Elaine. Ellen, our old public health nurse, has been able to do some, not as much as I had hoped for. And Galen Ferner, the previous mayor, who's a nurse in Melrose, is doing she's clearing the isolation cases for both Melrose and Wakefield.
Good,
So
okay.
that we can, one thing that we've really had a hard time with is clearing cases, which is what's more important to fire and police, so that they can take those addresses off
Right.
their list, even though they're supposed to assume every address they go to is positive. Obviously, they like to know for sure. So if we can do a better job at clearing cases, that will definitely help. Chief Sullivan will be very happy. So we're doing two things. We're hiring more people, and we're divvying up certain discrete tasks like clearing isolations
Mm.
so that Elaine is doing the casework. And she emails Gail and says, here's the person's name, here's their information. Here's their last day of isolation. Gail calls them on the last day. How you doing? Awesome, you're cleared. So,
I have been clearing most of my cases. My cases in Melrose, I clear myself. I've been closing them. And I've been helping with, like poor Ellen couldn't get into Maven, so she did the interviews, and there's a girl, one of the nurses here in Wakefield, and they have been phenomenal. They'll do the case and then Karen sends it and then I put it in, which has been wonderful,
Yeah.
because it helped me to kind of pick up on a couple of things that kind of had a common thing. But I think the one thing it's really been hard is the cases now have so many contacts.
Yeah.
So you're entering 6 or 7 contacts per case. And sometimes they'll come up when you put them in as a contact, as a case already in there somewhere, and who you're notifying, the local boards of health, and going back in and then picking them up as clusters, and then, calling ISIS and, having, call them to change things. And the funniest thing was, I don't know if Karen told you, but the Epi on call called me over the weekend to report a case for Wakefield. And I says to him, do you know, he goes, yeah, isn't it you taking it, Elaine? I go, no. I says, Karen's in today. It's okay. You can call her, but if you don't get her, let me know. I'll let her know. They're
Yeah.
all confused. They don't know who's who anymore. But it has been,
Monday, we had 2 preschools
yeah.
with very long lists of
Mhm.
contacts.
Oh,
We had
Yeah.
a Melrose healthcare provider
Mhm.
was positive, and we had 2 days worth of patients to contact. So yeah, these contact lists are difficult, and I did some of them to try to help out. Karen gave me 4 to call. I was able to reach 1 out of 4.
Mhm.
2 of the other 3 called me the next day. The
Mhm.
4th one has never called.
Yeah, that's a lot too.
It's
I think
very time consuming.
they are, and they call you. Like I put out 3 calls this morning for new cases, and my last one called back at like 4:30, 4:45. So you're going back in again, and meanwhile you're on the phone with this one, canceling this one out and crossing this one out, and it does take time, and some of them never turn you back. They never call you.
Yeah.
I don't know. And my big thing was I wonder how many people now this week after the testing, I said to Karen, I'm going to watch the numbers and watch the people to see how many people will answer us. Because it's Christmas and they figure they're going to be in isolation and quarantine. Although most of the people, new cases this week, seemed like they were happy that was going to happen. I think that's their excuse to stay home. They have a very valid excuse and don't have to have company. Somebody said to me, I said, you can't have anybody in the house. Oh, yes, thank you.
well, the peer pressure is immense.
It is. It
You know,
really is.
And what I try to tell people, I said, okay, one more time, COVID is not a moral thing. It, the only bit of behavior that is related to is breathing. And so we all have that common denominator. So you can't be going oh, I know them, they're fine. I'm like, you cannot know this. This is not, there are no other markers besides breathing.
Yeah.
And so I now tell people, because I've gotten those calls of 6 degrees of separation, I said, just think of the hassle factor of contacts. Just put your mask on when when your neighbor comes to bring you Christmas cookies, just have your mask at the door and put it on. It's, and then.
Well, the good news is that all the Stop the Spread sites are closed tomorrow.
Because of the
Oh, really? Oh,
So-
what a sin.
Yeah, too bad, huh? So hopefully we'll have less cases
Time to catch up.
to deal with Friday and Saturday. I will say that the people who were tested on Sunday had their test results very early Monday morning.
Awesome. Awesome. They
Less
did.
than 24 hours with the Broad Institute.
The Broad Institute's been amazing.
So I must say that Friday, with any luck, should be a lighter day. I was gonna say something else, but I can't remember.
Ruth, while you're thinking, since our last meeting, you sent us the performance and implementation evaluation on the Abbott Buy Next Now Rapid.
Yep.
And we're on the list, I saw, Wakefield.
Well, Wakefield applied, but the superintendent has decided he doesn't want to do it.
Okay, good enough.
Melrose is doing it.
Okay, well, it'll be a good contrasting experiment.
Yep. I think that's all I have on code. Oh, I'm sorry. The other thing I wanted to tell you is that Coral and Cindy have both done the Maven training and test and are waiting, so that Coral is going to be doing interviews and Cindy is going to do strictly Maven. So we will have an additional person to be entering
That's great.
cases to help keep up with the paperwork.
Mhm.
And Coral, as you know, is awesome with people. So she's going to
She
be
is
doing
awesome.
interviews.
Yeah, she's very nice.
But she'll
Very,
also
very-
be able to do her own Maven because she'll have access to Maven.
Yeah. Mhm.
Um,
Oh, it'd be
so-
nice to see all those familiar names on the webinars on Tuesday.
Yes, I did go on today's this week's Tuesday webinar.
Yeah.
Just add one more weekly webinar to my
Yeah.
calendar.
Mhm.
Although it was very interesting because this week's webinar included doing childcare.
Yeah, was.
And we had 2 childcare clusters this week. So, you know, it was just very timely and interesting.
Mm. It was. It really was.
So, in other news, believe it or not, there are other parts of the health department functioning. Tobacco is alive and well, and Tufts Convenience Store in Greenwood, we issued them $1,000 fine.
Ooh,
Ooh.
Yep. Well, that's the new law. That's the new fine structure.
Mhm.
They're selling, not only are they selling, well, they are selling flavored tobacco products, and they're doing it secretly.
oh,
Oh.
But Maureen found the stash.
I love her.
She's
Undercover
so
Granny.
good. Yeah,
Yeah.
she's
So
good.
awesome.
She's awesome. So they had a sale first, and then she went back, and she had looked in the back before, but hadn't found it. But knowing that it was definitely there, she looked like through every single possible place, and she can't remember where she found it, but she found it.
she sniffed
So,
it out. Wow.
$1,000.
Mhm.
Yep.
Yeah, I almost called her because I picked up a few with a gloved hand on a walk. I was like, oh, so they're not the little, they're now the one timer. They're long. So the
Yeah.
products are a little different.
So, yeah, so the tobacco program is going strong. Substance abuse is going strong. Laurel, you were
Yep.
on the wake up call this month.
Yep.
So they're doing great work and are continuing to be active. And the youth action team is very active. So that's all good. The Mass Call grant is in. The grant, the DON grant is in, although I know the DON grant, we don't hear till February 1st.
Mm.
And I don't remember when we hear about the Mass Call grant, but I'm sure it's after that.
Ruth, do we have jurisdiction on, I know we have dumpsters, but those, I don't know what you would call them, but those receptacles that people do donations in that often get overwhelmed,
Yes,
those permitted through us?
they're not permitted. However, we do address when there are problems.
Okay.
So if you remember, there used to be a couple of boxes
Mhm.
on
front of Mike's gym.
Broadway in front of
Yeah.
Mike's gym
Yeah.
that were horrendous. They
Yeah.
were just, it was a bad. So we told them they had to remove them. And then they asked, could they have them further back in the parking lot? And I said, yes. And so I think they have, so if you look in the parking lot on the left-hand side near the train tracks, like maybe halfway down the parking lot, you'll see the containers, but they're not overflowing at all because the
That's good.
public, they're not right out. I
Well, this,
know the one in Greenwood is a problem.
Yeah.
Coral is on it. She has talked to them several times. And, if it continues to be a public nuisance, we'll tell them they have to remove it. We hate
well,
to
the
do it because,
the schools often have them, but
yeah,
I think they could use a little muscle from us to get the companies to get them to empty them more often. So,
well, the ones that we have problems with, yes. The
Yeah.
only one that right now that we are having that we have had occasional problems with is that one in Greenwood in front of the oil company in church,
Oh, yeah.
right, yes,
Yeah,
yeah.
yeah, that always has been like that.
So
always.
that's a problem. They've been very responsive when Coral calls, but I've told Coral it can't be a situation where we have to keep calling.
Right.
So either they can keep up with it, or we just can't have them there.
Yeah, there were some issues at the Woodville school as well, and I don't think people realize that Board of Health are the ones to call.
I wonder too if it would make sense to kind of remind folks about the curbside textile recycling program too. I think a lot of people don't quite get how that works.
We can, I can talk to Jen McDonald. She's always looking for ideas to communicate. And that would be an awesome one, is to remind people, hey, when you see those pink bags
Yeah.
those are textile recycling and you can have that too.
Yeah.
And,
It's so easy. I mean, put it out with your recycling. It couldn't be simpler.
I can
Well,
tell you, people grab them if you put them out the night before.
Yeah, they
for
will.
recycling.
what do you mean they
But-
grab them?
They
They
so-
take 'em.
So the company very specifically says, put them out after 7 a.m.
Mhm.
If you put them out the night before, somebody else grabs them. Now, I mean, hopefully somebody else can do something productive with it, but it's a little annoying.
Yeah, I mean, I keep one and I just throw stuff in,
Yep.
Mhm.
Because
Yeah,
you can
with-
put things that you wouldn't necessarily donate, like a T-shirt with a rip, because they'll
Yep.
recycle it.
Yep.
Right, that's
doesn't have to
what
be
I have.
something for the goodwill
Socks
that
with
another person
holes.
might-
I don't throw any of that away, ever.
Yeah.
It just goes in the pink bag and eventually it fills up.
And other things like bags and shoes can go in there too. I think people might not remember that.
Yep. That's a great idea, and I will give that to Jen for her to talk about. She does newsletters, but she's always interested in just, doing news blasts about different things, and that's a great idea.
I wonder if some people too may hesitate because they're not quite clear on where it goes. Like, is it a for-profit company or I don't know. If people had like a piece of information about what happens and what kind of company is the company that's picking it up, maybe they would be more excited to take advantage of it.
Sure. Awesome.
Okay.
Okay, so I think Kara with Mass in Motion and Youth Action Team is pretty much working 100% remote. Catherine is, hybrid, as I guess we would call that.
Mhm.
Cindy's in the office. I'm not in the office very much because of the setup with Cindy there all the time and Coral in there too.
Yeah.
It's just too many people, so.
Yep.
I'm actively doing Wakefield work, but not necessarily in the office.
Well, you have your own breathing space in Melrose.
I do, I have my own office, so that makes a big difference. But I do try to get in at least once a week to just touch base and say hello, feel that.
Okay. Friday morning, 10:30 calls continue.
Yeah, they do.
Hopefully he won't have one next Friday. I did mine from the road, so you couldn't tell it was me, but I was listening.
Yeah, the next 2 Fridays are holidays, so I'm sure we won't be doing
Right.
those.
Right, but this Friday.
But yeah, and it's well timed because I have a Friday morning call with DPH at 9. So
Just go right on.
if I have any new news to communicate, I have an opportunity, there's a forum right there to be able to communicate the new information.
Mhm.
So, that's going well. Everything, it's going well. It's overwhelming right now. The public health nurses and all the nurses, all the people doing contact tracing are very discouraged, I have to say, and frustrated about the volume and not being able to keep up with it.
Yeah.
And I remind them of the oysters on the beach para story about, guy walking down the beach, picking up the oysters and throwing them back in the ocean. And the other person says, there's a zillion of these oysters out here. You can't possibly do them all. And, what difference does it make? And the guy said, well, it makes a difference to the oyster that's being thrown back in. So
That's good.
that's what I tell them about these cases. For every case we do get to, it does make a difference to that case and definitely closes that circle of potential spreading.
It not only does that, but I think that the learning experience has been amazing. I've even noticed, Karen says to me, stop picking up on these things. You drive me crazy. But actually, it's funny because all of a sudden you'll see the same symptoms, like the loss of smell and taste will come in for 3 or 4 weeks. And then all of a sudden it will go back to fevers and nasal congestion. And that's what everybody has this week. So it's almost like the virus, is it change or what does it change? And it's like the week that you get it, or you get that person who doesn't get the symptom until the 9th day, and the other poor person that has a brand new one every single day. So I think it's just, I find it fascinating to listen to people. I think it's great. I think it's very interesting to see what's really going on.
Is there anything we can do in regards to messaging or New Year's cards or something from the board? I mean, I just,
Ugh. There's so much messaging out there.
Yeah.
I haven't seen the new messaging from the state, and I watch a lot of TV, so I don't know why I haven't seen it, but they have a new messaging campaign.
No, I mean for the board to support our staff. I mean, within our small circle.
Send chocolate.
Okay.
Was that what it?
Well,
you know what you can do is I missed the mailman today. I was a little behind writing some other things out, and Sunday is Karen's birthday, so I have a card all written for her, and she does deserve a birthday card. She really does.
Yeah.
She mentioned it today. I called her about 2 weeks ago when it was a really, really bad day. And I think she'll tell you the story someday. And I said to her, hey, what are you doing? She says, what do you think I'm doing? I says, are you free? She said, well, what do you mean? I said, listen, I can't drive yet, but can you come pick me up? I got a clear credit card. We'll go to the airport. Don't even bring your toothbrush. I have new toothbrushes, and we'll just put the card down, and the next plane we're going. So she says, okay, I can be there in 20 minutes. 20 minutes. I said, okay, I'll be ready.
She's had some very rough days.
Oh, she has, but she, like I tell her, just call me because I know, well, and I've seen.
This is a public meeting, but hopefully she's not listening, so.
She actually is back working in the office a couple of days a week, like Tuesday, Wednesday, and Thursday, which is very helpful for both of us, I think, and it's much easier for us to communicate instead of texting with each other back and forth. And I think it also does provide some more moral support.
I agree. I've said that all along, that all of this distant work is very stressful for the staff, because you can't, like, you can't sort of hear the buzz and then know when you might be able to jump in and help. And that person isn't going to call for help because they're in it. But
It is hard. It's frustrating. And I said that to Karen one day. I did something for her and she goes, oh my God, thank you, thank you. And I said, I don't feel like I'm doing enough. What more can I do? Let me do this, let me do that. And then you do it and then you just don't feel like it's enough because it's overwhelming. It is overwhelming, I'll tell you. Today, I could have, it was like,
Okay,
just kept
public
on
meeting,
coming.
yep,
public
yep,
meeting,
All right, can you want to set a
not
date?
venting session.
What Ruth, do you want to set a date or because you're thinking of possibility of, doing something? Do you want to set the date for the third Wednesday, which is the
January.
20? Oh, that's inauguration day, so it might be a good day. We'll see.
Yeah,
Is that okay? But we
Yeah.
can change it if
we
you
will
get
set it,
something.
it's
Okay.
set up for third Wednesday
Yep.
on the calendar already.
20th, yeah.
Okay,
And, hopefully before then, we will be immunizing fire and police, so I can give you updates on that.
okay.
Are
And,
nurses included in the first responders?
who?
Are nurses?
Not in clinics,
No.
unless you're a
No.
vaccinator.
But you're a healthcare worker, so you're actually,
Oh, no, I'm
Before-
worried about your nurses, like our nurses, like
not, but if they want to be, if they're
vaccinated.
gonna be a vaccinator, they will be.
Yeah. I mean,
Give them that opportunity.
if there's one thing that maybe we could facilitate would be getting them, if they wanted, the vaccine.
Well, we only have one nurse.
Well, I mean,
Yeah.
all of the coalition.
Yeah, but any nurse who wants to help with vaccinating will be vaccinated.
Right.
So, so that's the good news, and hopefully we'll be doing that, as I said, the first week, even if we're just vaccinating the vaccinators the first week in
Yeah.
January.
Beautiful.
That, would be a good start. So, the light is started, the vaccinations have started, which is a good thing. And, the key will be what percentage of the population gets vaccinated.
Right.
Mhm.
It's reassuring to hear so many of the first responders are interested.
Mhm. And the hospital work is 100%
That's
is very
excellent.
good. That's
That's good.
awesome.
They're the ones who are they're the ones holding people's
Yeah.
hands as they die.
They are.
Oh, yay.
Kind of tells you.
Okay. All right, so if I can have a motion to adjourn the meeting, and the next meeting will be held on Wednesday, January 20th at 7 PM.
Hi,
Sure. Oh, I'm sorry. Yeah.
yeah, sorry, I wasn't sure when to speak. So I'm new here, and basically, I don't know if I want something discussed. Do I need to put it in agenda, or how do we do it? If you can just guide me.
So what the best way to do is contact me before the meeting so that it can be put on the agenda.
Okay.
And my email is rclay,
I think we have your
R-C-L-A-Y.
email.
Yeah.
It's not a new issue we are going to bring up, but we just wanted to make sure that it's discussed in monthly meetings so that
Nice. Thank you.
Okay.
Sure.
Thank you.
But we also have public participation at the beginning of every meeting. I think you came on
Just
Later.
after the beginning of the meeting. We had already had public participation, but
Okay.
we have that at the beginning of every meeting.
Okay, so I can join in next meeting and I'll send you a mail personally to
Sure.
put a complete agenda.
Mhm. Yes,
Thank you.
that would be very nice. Thank you.
Thank you so much. Thank you, guys.
Thank you.
Hey, everybody, I make a motion to adjourn the
Okay.
meeting and to make sure
Laurel?
that you all have a happy new year.
Thank you, Laurel. Same to you.
Stay safe.
I'll second that motion and the happy holidays.
Thank you. All right, all in favor, Laurel,
Bye. Candace.
Candace.
Candace,
Candace, all right, I'm writing it. I apologize. I'm sorry. I'm writing 90,000 things today. Candace,
Okay.
okay? All in favor? Nobody objects? There we go. So the meeting is now adjourned and it is 8:03.
8:03.
Hey,
Proceed.
nighty night.
Thank you, everyone. Have a nice holiday and whatnot. Enjoy.
Hanging.